Welcome to the Fascia-Informed Therapist podcast, designed for health and wellness practitioners interested in fascia science. I'm Amy Mayer, occupational therapist, practice owner, author, and educator with more than 30 years of experience using fascia techniques across many settings. Each episode brings practical insights and thought-provoking conversations to help you expand your skills and better serve your clients. Let's get started. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. And today I'm talking about something that's got me pretty hot under the collar. I hope it does you as well, and it's definitely not the topic that I had planned. But when I went to look for the most up-to-date information that I could find on PubMed, I was met with this big banner across the top of the website, and I'm going to read you the banner. So if you've been there, you've seen it. Now I've been on PubMed quite a bit recently, but I don't remember seeing this banner until now. So I can't tell you how long it's been there, but there's a notice. Because of a lapse of government funding, the information on this website may not be up to date. Transactions submitted via the website may not be processed, and the agency may not be able to respond to inquiries until appropriations are enacted. The NIH Clinical Center, the research hospital of NIH, is open. For more details about its operating status, please visit ccnih.gov. Updates regarding government operations status and resumption of normal operations can be found at opm.gov. And I'm assuming this is because of the shutdown that we're experiencing right now, but I don't know if it's because funding has been, other types of funding have been pulled. We know that the NIH has had some funding pulled. We know that funding's been pulled from a lot of scientific research that's going on around the country. Anyway, I don't know. I can't say that, but this just has me so frustrated. So I went to the two websites they give to look at for updates, and one of them was the NIH Clinical Center, where they do the studies, and they have a big red banner that says the NIH Clinical Center is open. We will continue to provide patients already established and enrolled in clinical studies, and we will enroll new patients in exceptional circumstances. Because of a lapse in government funding, the information on this website may not be up to date. Transactions submitted via the website may not be processed, and the agency may not be able to respond to inquiries until appropriations are enacted. Updates regarding government operations status will resume, and resumption of normal operations can be found at opm.gov. So you go to opm.gov. And there's a big, triangle with the exclamation mark in it across the top. It says Washington, D.C. area operation status. Due to lapse in appropriation, federal government operations may vary by agency. Applies to all federal government until further notice. And then they have these big advertisements on here. And one of them is about the 2026 special rates for certain law enforcement personnel. So, of course, that got me super hot under the collar because we are taking funding away from scientific research, and we're funneling it into, when you click on that, of course, you see who's getting bigger salaries and greater bonuses and expanded FTEs for these areas. And of course, the top two are Customs and Border Protection and Immigration and Customs Enforcement personnel. So, we all feel differently about these things, and I'm extremely frustrated with how things are going in that particular arena. But I want us to focus on in this podcast about the scientific aspect of this and how it affects. If the NIH is continue to be funded less, defunded, funded less, however they're doing it, that affects us. I know not everybody that is listening is from the United States, and I so appreciate you all being here. And I can't say what is going on in your countries, but I know some of the really cool studies that I've been looking at recently have been done in places like Switzerland and Italy, and really interesting, important studies coming out of there. And I'm fearful for what we're going to be able to continue to do here in the United States if things continue going like they're going. Okay, so it's likely that this is the big banners is just part of the shutdown and not because of being defunded, but I don't know that for sure. And I don't want to spread any misinformation because I get super frustrated when I see stuff like that going on. But this just gives me an opportunity to talk about how important these things are to us, because if you're listening to this, you're probably listening to it because, and some of the most well listened to, several hundred people listening to the ones where I'm saying, okay, I'm going to talk about a study. And when I talk about a study, though, that gets you guys listening the most. So I know that you care about what's going on. And if people can't get the latest and the greatest from PubMed, I mean, most of us who are small businesses like me can't afford to go and purchase from purchase articles. And here's just a little tip for some of you, especially in the United States. When I see students from certain universities, one of the benefits you get for taking a student is access to their university library. So if you want that, talk to your local university that you take students from. Well, first take students and then talk to that university as that being a potential benefit. Because that's really huge for me to be able, if I can't find it online and I can find it, but I can only find the abstract, then I can go into that particular portal and likely find what I'm looking for or get my hands on it. And then sometimes if you have students, you can ask them to look it up for you because they have access to their libraries from their school. Anyway, so if people can't find the latest and the greatest and be able to read it for themselves in terms of scientific information, there's a greater risk for misinformation. People will turn to what they can find on the internet or through AI now and just looking for something to help them. And then who knows if what they're finding is the best, most recent information. So super, I hope you can tell how frustrated I am and how hot under the collar I'm getting about this. But anyway, so much of our science and our research is tied to government support. And when that gets interrupted, or defunded, then that changes so much. So I would encourage you, if this gets you hot under the collar too, then send something to your representatives and let them know how frustrated you are about this, and encouraging them to continue funding all kinds of science and all kinds of research so that we can continue to grow and understand what's going on. So please reach out to them and encourage them to continue funding the sorts of things that you care about. Anyway, I'm keeping this short actually because I am headed out on a much deserved week of vacation, visiting friends and family that I neglected over the past year, getting the book done. And then I'll be back here for a week, and then I'm going for a longer total rest vacation for a couple weeks. But I will say, here's the good news. When I got on PubMed and typed in what I was looking for, I actually got a 2025 October 1st study that popped up. So if I can find little bits of time to read through some of that, that's what the next podcast will be on. So anyway, as always, if you found this helpful, I know some of you might not agree with me and maybe we'll stop listening. That's okay. That's fine. But if you found this podcast helpful, I certainly would be grateful for you to leave a rating or review. It helps other therapists and practitioners find the podcast and join the Fascia-Informed conversation. So here's to advancing practice, one Fascia-Informed step at a time. Thank you. You've been listening to the Fascia-Informed Therapist podcast. Be sure to subscribe so you don't miss new episodes. And if you'd like to go deeper, check out my continuing education courses, both online and in person. You can find them at fasciainformed.com. Thanks for listening, and I look forward to next time.